This is the Healing Our Sight podcast, where we discuss vision issues and healing strategies from the patient perspective. The goal of this podcast is to create an awareness of the diverse types of vision issues people experience, to highlight the types of help available, and to open a dialogue between patients to show we're not alone in our vision struggles. As a patient who gained 3D vision at age 54 through vision therapy combined with strabismus surgery, I feel uniquely qualified to offer a hopeful, balanced perspective on the possibilities. Please use the link in the show notes to send me a message, and thanks for joining me today. Welcome to the Healing Our Sight podcast. I'm your host, Denise Allen. Today, I'm very excited to introduce my guest, Dr. Carl Rothschild, who is a pioneer in red light therapy with over 40 years of experience in healthcare. After decades as a chiropractor and clinic director in Los Angeles, Dr. Rothschild founded Trifecta Light to explore how red and near-red light can support energy, healing, and overall wellness. He brings a grounded, science-based approach to one of today's most promising therapies, and I'm so excited to talk with him about how red light might even support visual and brain function. So welcome today, Dr. Rothschild.
Thank you so much for having me. I
Yeah.
appreciate it.
Absolutely. Can you tell us a little bit more about how you decided to explore red light therapy?
Sure. So I started in 1978 as a chiropractor,
Mhm.
and I was a bit of a I was my version of a hippie, so to speak. And my version was that money was not as important as I wanted to help people. I know it sounds corny, but I don't mind making money, but if I only made money and didn't help people, it wouldn't work for me. And of course, if I only helped people and didn't make any money, that wouldn't be great either. But the fact that I can help a lot of people and also have a decent living, I appreciate that a lot. So I became a chiropractor, and my goal was to help as many people as I possibly can. I've had 12 practices, but about 26 something years ago, when very few people were doing it, I was introduced to red light therapy, and I'm considered sort of a pioneer in the industry. And, in fact, I wrote this book here, but they can't see it if they're not seeing it in this video, but it's called Illuminated Healing. I don't make any money from it, but it's on, Amazon. It's called, again, Illuminated Healing, and it's actually a good read. At any rate, um, and I was introduced to red light therapy, with the notion that maybe it could help, but we knew one thing for sure, that it could not hurt. And, sure enough, I was starting to I mean, it revolutionized my practice. I was starting to be able to help people with things I never dreamt of before, including just about any ailment, physical, I should say. Like someone came in with a ripped Achilles tendon that normally we would just have to send for surgery. And we did get a surgical consult, but before the surgery actually was needed, we were able to heal that ripped Achilles tendon. And then this person had a kidney problem, and he said, "Can you help my kidney?" Now, believe me, I know it's not in my, it's not. I'm a chiropractor, so it's not really part of my domain of becoming a kidney expert, so to speak. But we helped the guy's kidney. What can I tell you? This lady had a gum disease, and we helped them as well. And then about 13 years ago, it was discovered that there was an element of red light that actually helped with weight loss. And I said, "Well, wait a minute, because I know that's a tough one, and if you could do it in a natural, healing, healthy way, I wanted to get on board, so even in a bigger way, so I got involved with manufacturing. And we were making, devices, we were involved with lasers, and we were involved with pads, and we were involved with different things that helped with healing, but also with fat loss. But then COVID hit, and our practitioners wanted less physical contact between the patient and the provider. And we came up with the bed, because with the bed, you don't need staff. The person gets in and out of bed themselves. And we just thought it would be a nice substitute for what we were doing up to that point. Little did we know that what we learned is that when you bathe the entire body at the same time, you will get unbelievable results. So in the past, as I said, I might use a laser on a shoulder or on a TMJ problem or something like that. but now we're covering the entire body. And within a short period of time of us having delivered our first series of beds, we were getting feedback that was startling, is the only word I can use. So this guy, for example, had Parkinson's, and it wasn't our idea. We just said, well, we just know one thing. It couldn't hurt, so why not try it? And it helped him tremendously. And this guy had Charcot-Marie-Tooth disease, which is a rare hereditary autoimmune disease. So he couldn't walk comfortably, and he was in pain every day. And after 6 visits, he's interviewed, and he looks at the person that's interviewing him, and he says, "Thank you for giving me my life back."
Mm.
And that's when it hit me. That's why I became a chiropractor in 1978, because I wanted to help people. And now more than ever, I'm hearing, "Thank you for giving me my life back." What else? What could be better than that?
Right.
And so this guy's walking, he's on a treadmill, and this other guy contacts us, and he's having a heart attack once a week. Had you ever heard of that?
No.
I had never heard of that. And they had implanted a defibrillator in his chest like 13 years prior.
Mhm.
So he was having hundreds of heart attacks in that period of time, and he was dying. His heart was I think it was about to give out, to be honest with you.
Wow.
And and so he contacted one of our providers and said, "Would you can you help me?"
Mhm.
And the provider called me up, and I said, "Look, let's just treat him for 5 minutes and stay in the room the whole time, because we know one thing for sure, you couldn't hurt. So let's try it." And that patient went home that night after that one 5-minute treatment. Normally a treatment is 12 minutes. Went home after that one 5-minute treatment, and that was nearly 2 years ago, has not had a heart attack since. He's had more treatment, but no more heart attacks.
Wow.
And everything's come back to life. Everything. He was dying. Every organ and gland, his energy, everything was gone. And it's all he would say, it's like he says, "My energy is through the roof." That's his exact phrase that he would use, and just how grateful he was that he has a new life. And that's what we're hearing again and again, whether it's Lyme disease or shingles or whatever. So now let's talk about the eye. Well, we'll talk about the eye in a moment. I just wanted to point out something.
Yeah.
Is it well known where you are right now? It's not a
I
secret.
I don't know that I've talked with anyone in healthcare to be able to know whether it's well known, but I would guess it's not.
Well, let me tell you something. Many of the much of technology out there was started in the United States,
Mhm.
and then taken by other countries and duplicated and actually stolen.
Right.
This is one of those rare opposite, where it was developed in, guess where?
Probably in
China.
China. Yeah.
Yeah.
Okay.
And so the technology was actually, and I'll tell you why. In countries that medicine is not about a profit center, it's not all about making as much money as you can. And the United States is not like that at all. It's about making as much money as you can. The whole healing industry is geared towards, almost everyone in the medical profession is gonna be a multimillionaire. That's the goal, I think, for them.
Mm.
And, this is why the new administration, I'm not gonna get political here, but there is a leaning with RFK Jr. to look towards maybe less of the profit issue and more healing more people.
Right.
Well, red light's all about that, to be honest with you. It's not about doing surgery or drugs. I mean, sometimes you do have to do it no matter what, nothing else will help, but
Mhm.
it's about a great, beautiful, natural alternative.
Yes.
So China actually started the whole thing, and we brought it here. So the doctor who brought it here, got the FDA clearance, was Chadwick Smith, and I knew him before he was involved with red light therapy. And thank God I knew him, because he's the one that convinced me to shine a light on somebody and it's gonna make a difference.
Mm.
Now in the back of my mind, believe me, I'm thinking he's crazy, right? Okay, I'm gonna shine a light on somebody and it's gonna make a big difference. I did not believe it. And little did I realize that not only, so we took it on to try it out. And as I said, it revolutionized my practice, but it's taken over my world. I mean, this is all I think about in the world of healing and stuff. I mean, I love being a chiropractor, but you know, there's a lot of controversy around chiropractic, and I don't want to go through all those reasons, but there's none with red light therapy. So it's a real pleasure that I don't have to deal with, different professionals who think I'm a quack because of it or whatever.
Mm,
And it's lovely and it's so easy to get in and out of the bed. I have one here in my home, and I'm 72 years old, and I tell my patients it's not about not getting older. It's gonna happen. It's
right.
about trying to age gracefully. It's like a candle that burns bright from the beginning all the ways to the end and then sputters out and dies. Instead of spending the last 20 years of someone's life in a wheelchair, a burden on society, they can't feed themselves, they can't wipe themselves, they can't bathe themselves.
Mhm,
And I don't want that. I never wanted that. So I've always taken pretty decent care of myself and staying away from the obvious things that will do anybody in.
right.
In fact, I tell everybody the reason why most people are not the ones who don't take care of themselves is because they're not scared enough. They don't know what they're doing to themselves today, how it's gonna pan out when they're 40, 70 or 80 years old. I
Yeah.
used to teach a class, "Will you be dancing when you're 75?" I had to change it to 70 because no one believed they were gonna be dancing at 75. And the truth of the matter is there's a lot of people who just don't take care of themselves because 'cause they're living for today, but the truth of the matter is that's not true. You're living for today, but you're also living for what kind of future you're gonna have.
Right.
At any rate, that was the story about China and how we took it here. We did the opposite of what China normally does, is take our technology and bring it there. We took their technology, brought it here. And, it has been unbelievable. But like I said, by building the bed and bathing the whole body, one of the things that we do is people ask, well, should they wear goggles when they get in the bed?
Mhm.
And I tell you, well, if you do that, you won't get all this glorious, beautiful energy into the eye.
Right.
So instead, if I'm telling you that it can get through the skull and get to the brain, and it can get through any tissue and get deep into your tissues, then you know it can get through the eyelid. So you just would keep your eyes closed when you get into bed. Because
Mhm.
and you could open your eyes. It's not radiation, not any of that stuff that people fear, but it's a very bright light, and it can
Mhm.
give you a headache, I suppose, if you leave it open the whole time. I leave my eyes open from time to time just for but knowing that it's not gonna be able to hurt me.
Right.
But it's something that you acclimate to. At any rate, let me give you some examples.
'Kay.
We have a lady that had uveitis. Now, normally the pressure in the eye is somewhere between 10 and 12, and
Mm.
her pressure was 180.
Wow.
And these are millimeters of mercury, but it's just like a temperature, but instead we're taking pressure.
Mhm.
And the pressure again in her eye was 180. And the treatment for that was an injection once a month right in her eye.
Mhm.
And I asked her, what was that like? And horrible, horrific.
Yeah.
And she also had to take drops. And the drops alone, the copay for the drops were $400 a month. The
Mm.
injections are $5,000 a month. I don't know how much I'll copay on the $5,000 injections, but the copay on the medication was $400 a month.
Mhm.
And, she doesn't need that anymore. Her pressure is now gone back from 180 is now normal. It's around 10 to 12. Now,
Wow.
did we expect that? Not really. All we knew is we couldn't hurt, right?
Yeah.
And we tried it.
So is she
So
coming into the office for that treatment then, or did she buy a bed to use at home?
no, no, she was getting no, there's 2 kinds of people. There's people that have more money than health, and they buy the bed. But, the average person, it's not inexpensive. These are medical grade, high-end pieces of equipment
Right.
that cost about $1,400 a month to lease.
Mm.
So most people who have the money will do it, but most of the people are businesses that buy it to build their business, and
Okay.
it's a great way to build a business, and $1,400 is a very simple thing to make back. Most of our doctors and professionals are making at least 10 times return on investment. At any rate, getting back to the eye,
Mhm.
floaters in the eye, we've seen that almost within 2 weeks, those are gone. Um, cataracts, we already talked about uveitis, but glaucoma is in the same category.
Mhm.
And so we're seeing phenomenal results with the eye.
And
Now,
what about macular degeneration? Is that something you've
and
also?
macular edema and macular degeneration, great results with those as well. So
Okay.
people are about to lose their eyesight, and now they're not. We had a guy that had Leber's hereditary optic neuropathy. I'd never heard of that before.
Right.
It's there's a whole community called LHON community, and these are people that essentially have multiple sclerosis of the retina,
Mm. Wow.
and they're going to go blind. There's
Hmm.
no question. You're going to go blind with that because what it's doing is it's eating away the retina. Very similar to multiple sclerosis, which eats away nervous tissue.
Hmm.
And similarly, if you get in a full body bed with multiple sclerosis, it will halt the progression of the multiple sclerosis, most likely. Again, what's the worst that'll happen is nothing. I tell
Hmm.
people it's 3 times a week for 2 weeks, that's 6 visits, and then report back to your professional and tell them this is where you were and here's where you are now. Did it make a change? Did it help you? And
Right.
most likely it will help.
Okay.
You might need a lot more treatment or not, but at least you'll have seeing that it can make a difference, whether it's Parkinson's or dementia, Alzheimer's, multiple sclerosis. Uh, I mean, you could just look these things up. And
Yeah.
I'm going to tell you an easy thing to do is to just go to Google Scholar.
Okay.
Have I mentioned Google Scholar to you before, or are you
You
familiar with
sent me some, yeah, you sent me some stuff earlier when we were discussing the episode, where you found a bunch of studies on Google Scholar
it? So
regarding
if
red
you go to Google Scholar and put
light.
in the word red light therapy,
Hmm.
I wonder if it would surprise you to find out that there would be over 3.5 million entries. That's double blind studies, research papers, articles, and whatnot. Now, not all of it's extremely pertinent, but 3.5 million, you're going to get a lot of studies that could help you. And then you would put in whatever the studies that you want to go up. So you put red light therapy and lupus, or red light therapy and some of the words that you use. What would you put in there?
Red light therapy and strabismus or
There you go.
amblyopia.
Our business. Yeah. This is not doesn't slip off, easily off my tongue. You just put those in there, and I think you'd be surprised pleasantly that you would see how research has been done,
Hmm.
on all these things. And, like I said, if it was something that had any potential of side effects, I would be concerned, but I'm not. You couldn't hurt. In the 50 years they've studied this technology, there's never been a recorded side effect.
Wow.
So I just want to go over how it works and why it works, unless you
Absolutely.
have a question.
Well, that's what I was going to ask you. Just explain a little bit more about how red light therapy works, because I don't think that it's very well understood.
It's not. And again, that's why I wrote the book, and I do recommend you get that,
Yeah.
and I don't make any money if I haven't already said that. I don't make a dime from it. But so now, how does it work? So it was discovered and started working on NASA started working on, but other scientists also, um, about 50 years ago, give or take. And they coined that phrase biomodulation. So photo means light, bio means tissue, and modulation means it does something. So it's just talking about how light can affect your tissues. And of course, they were using equipment that was very subtle back. It was the state of the art at that time, but a fraction of the power of what we can do now.
Right.
But what they discovered was that with all these changes and whatever, the direction always was about the mitochondria. So, your body's made up of tissues, and your tissues are all made up of cells, and every cell has mitochondria. Now, when I went to school, I was taught there was one mitochondria in every cell, and that's not true. So, for example, the heart, which has the highest demand for energy, and I'm going to go over what the mitochondria is about in a second, but you can take a hint that it's about energy.
Yeah.
Um, the heart has the highest demand for energy, and it has the average heart cell has over 5,000 mitochondria in each one of them.
Wow.
So that mitochondrial the mitochondrial tissue makes up 10% of your body weight. Nobody knew that until more recently.
Hmm.
And so can you imagine how important and prevalent the mitochondria are? So what's that about? As people get older, as they get sickly, there's always a mitochondrial, what they call mitochondrial dysfunction, where the mitochondria is not doing its job. The mitochondria's existence is the reason why you and I breathe oxygen and eat food. It produces the energy currency of the body called ATP.
Mhm.
What that means is that the ATP is what gets your body to function. It gives you energy, not only to do all the things that you and I are doing, but also to heal. So if you have mitochondrial dysfunction, your body is going to start falling apart. It goes disease, death. And if
Mhm.
you can get your mitochondria back in shape, you can reverse that. And that's what this is all about. But they still weren't positive how it worked until they discovered that there are elements in the body similar to plants that have elements that are stimulated by the sun or affected by the sun called chromophores. We have those in our body as well. In fact, plants have mitochondria
Mm.
and they are stimulated to create the energy in a plant. So maybe somebody, I could tell jokes about how, they did the plant and then they couldn't figure out. Anyhow, I'm not going to get religious or non-religious here, but I can just tell you, and I'm a wise guy from New York, so forgive me. I joke around sometimes. Um, but what they found was that there was an enzyme hidden in the wall of each of the mitochondria called cytochrome C oxidase. Cytochrome C oxidase. And it's a chromophore, meaning that it's stimulated by sunlight.
Mm.
And what does it do? It stimulates your mitochondria to come back to life.
Okay.
So what I'm saying to you is that this whole conversation I'm having with you is essentially about sunlight,
Mhm.
but only the glorious, wonderful elements of sunlight, not UV light, not blue light that can screw up someone's circadian rhythm. It's about red and near infrared light.
Okay.
In fact, if I may tell you, there's a word called infrared, and probably everyone's heard that word. But there's
Mhm.
no such word of just infrared. It's either far infrared or near infrared. Now, far infrared is a fancy way of getting deep penetrating heat, which is nice. It feels nice, but you're not going to make any long-term cellular changes. Near infrared is the one that does that. And when it first came out, near infrared was interestingly so that we called it cold, like cold laser or cold light therapy, things like that. Not that it was literally cold, but it didn't get hot.
Okay.
And so that's the essence. If you're going to be working with equipment that's high grade, high medical grade, then you want to make sure that the lights don't get hot. Very powerful without heat.
Mhm.
That's the essence. And that's what costs more money than the junk that they're selling on Amazon and stuff like that. At any rate, to move right along, you stimulate the cytochrome C oxidase, you stimulate the mitochondria, you create the ATP that brings the body back to life. And that works in every tissue of your body. Now, it only works on the tissues that the effect is going to be noticed when the body recognizes there's a problem. So an example of this is a freckle. Someone says, well, it's going to affect the freckle. No, the body doesn't recognize a freckle as a disease or an illness or anything like that. So it's not going to attack a freckle. But if it was an infection or inflammation or any disease process or a sprain, strain, any kind of thing like that, then it will very much affect that. Now, as a chiropractor, one thing we learned was to remove the interference and then get out of the way. What that means is that we recognize that the body has its own innate intelligence that does the things that are needed. We don't sit there and go, okay, now heal this wound, and now bring the white blood cells, and now the fibrinogen or anything. We don't do that.
Right.
What we do is we correct it as much as we can. Just like if someone breaks an arm, they're going to align that if it's not aligned properly, set it, and then run away and let the body heal it.
Yeah.
But in some diseases, there are doctors out there that think it's their job to intervene.
Mhm.
And they sometimes, and if not often, make it worse. Get the body in a better position so it can heal itself. That's what this is all about. And that's what the sun does. And that's what we've done is we've taken 4 elements of sunlight 2 wavelengths of red light, 2 wavelengths of near infrared, integrated them together, magnifying them a lot, and drive it into someone's body, and
Mhm.
then run away and pray. And and kinda that's what we did, was like, we throw in all this beautiful energy and get surprised almost every day. Someone will call us up and say, "You didn't tell me it could help this or that," or we had a guy that had Lyme disease. He contracted when he was 12,
Mhm.
and it ruined his childhood. It ruined his education and social life, and of course, it ruined his possibility of a career. And then he's in his 50s, and he's decides he's gonna try full body red light bed, and that's ours. And, he gets out of the bed after the first that 12-minute dose and is goes, "This didn't do anything," and he just dismisses it as a bunch of hooey. But 5 hours later, and ever since, it's totally changed his life. So I'm gonna be sending you these videos, and if any of you out there want them, I'm assuming that you'll be able to get it to them. Watch these videos, 'cause that's what really should yeah, I'm the kind of person, if I see that, it's gonna rock your world. I mean, I'm the one interviewing most of these people, and it rocked my world. When I talked to Arnett that was having the regular heart attacks, or I talked to Jessica, who had 16 horrific things, including the uveitis that we described,
Mhm.
but psoriasis and 3 forms of psoriasis, and shingles and Lyme disease, and just a whole bunch of stuff, and they're all gone.
Mm.
I didn't expect that. I didn't know that it was gonna be that effective all the time. And all you do I suggest each of you go to the website, trifectalight.com, and look there, you'll see, find a location closest to you. One of our professionals will find the closest location to you, so you can try it. Try
Mm.
6 visits, that's 3 times a week for 2 weeks, 12 minutes a dose, and see what happens to you. And if you don't see any difference, which I think has never happened, the only reason I'm thinking that would happen is that the doctor forgot to plug the bed in. I don't know what else, because after 6 visits, there are very few things we haven't seen some results with. You know, some people have such tragic, horrific problems, it could take a year maybe, but
Yeah.
it's worth it. I mean, a year of that or to spend the rest of your life suffering. I'll do whatever it takes to stay healthy, and people don't realize what it costs to be sick. You have no idea what it costs to be sick if you've never been sick. Hospital stay, the drugs and everything like that. And yes, insurance covers some of it, but not all of it. And not only that, you miss work, you miss playing with your kids or being with your grandchildren or whatever. Being sick is a very expensive thing.
Yeah, it is. Can we back up just a little bit, though, and tell me a little bit about how, the trifecta light systems differ from what people are usually exposed to? Maybe, a do-it-yourself kind of version or a home red light tool or something that someone else is providing in their office that's maybe not the bed, but something that's more like what you used to do.
Well, until we made the bed, I thought we had the top of the line greatest thing, and then we realized that you really need to if I don't have an objection to a face mask or a helmet or anything like that, but you're not gonna get these glorious changes until you do full body at the same time. You have to bathe or whatever bed you're gonna recommend. I'm not here to discuss that. Here's what I'm gonna tell you. The first thing you wanna look at is lights that are very strong that don't get hot.
Mhm.
That's the most important thing,
Right.
and the ability to customize the treatment so that a person who's 80 pounds doesn't get the same dose who's someone who's 400 pounds. A 400 pounder can absorb a lot of this energy without it getting hot. Now, why
Mhm.
is heat a problem? Heat dilates blood vessels, brings more fluid to the surface. That's why your back or front will turn red, and that would block the penetration of the light, and it's self defeating.
Mhm.
That's why we called it cold laser in the past. We were trying to be under the radar as far as the body is concerned. The body didn't know what was going on, so we can get deeper penetration. Once you lit onto the body that thing's happening and it does dilate more blood vessels and bring more fluid to the surface, you're going to not be able to penetrate very deep. You won't have as great a results. So you want the highest grade, highest medical grade lights that can be very strong without being hot, but are customizable. So you'll have an 80 pounder not getting the same dose as a 400 pounder. Also, the ability to pulse the wave is a really beautiful thing. If you've heard of resonating frequencies or frequency healing or anything like that, different tissues in your body resonate with different frequencies. And so my favorite frequency that we start off with is 528 hertz. So if you were to go on Google and put in 528 hertz, HZ, and then put maybe the word healing energy after that, you'll see all kinds of articles, videos, and forums and things like that about the glory of 528 hertz. It's the universal healing energy, but it's also what John Lennon apparently used to write the song Imagine. But what we go through is we train the people on how to use the bed properly.
Mhm.
Another feature that you want is that you want the lights as close to the body as possible. As you come away from the body, you lose power exponentially. So when you have equipment that's a lower grade and gets hot, you can't have it as close to the body as we'd like it to be. With our device, it comes right onto the person's body, and that's an important factor. So high medical grade lights, lights that come close to the body, customizable so you can change the settings for the person who based on their condition as well as their size. Those are the three main features. There's others, but those are the main things that are involved. With our bed, I just want to tell you that we include all the training and 32 things actually with the purchase, but end of that.
Okay.
Anything else? Now, I
Um,
do recommend if people want to learn more about red light therapy, also go to the YouTube channel. So if you go to YouTube and put in Trifecta Light Official, there's over 100 videos, and they're not sales. I mean, they're beautiful educational videos. They're wonderful, and I'm very proud of that YouTube channel. And yes, I've created some of the raw material, but I have people that know what they're doing to make it really look beautiful.
mhm. So the videos that you alluded to earlier, are they on that YouTube channel? So people could just go
No,
there
they're
to
not.
they're
I'm
not?
going to send those to you. Some of them
Okay.
are on there. I'm sorry. Some of them are on there. You see, it's an interesting thing. I'm just reporting the news in my mind. When I tell you that so and so had a kidney problem and now they don't,
Mhm.
to me, I'm reporting the news. But some people out there think that I'm making claims that I shouldn't make. So
Mm.
I can't put it on the website. And it might not be on the YouTube channel that way. But I'm just sending raw video that a person, this is what they said. What am I supposed to say? You know, this woman had stage 4 renal failure. She was about to go into need dialysis. And after a month of treatment, her kidneys are perfect, perfect. Now, everybody says, often they'll say, well, do I need to continue once I've reached my goal,
Mhm.
whether it's kidneys or liver or thyroid or whatever? And the truth of the matter is that taking care of yourself is a lifetime endeavor. It's not something that you just do it when you're sick. You want to do it so you don't get sick.
Yeah.
So we people typically go on maintenance right after the program, and that could be once a month. It shouldn't surprise brush your teeth once a year. You're going to take care of yourself regularly because you know you want to keep your teeth, and it's painful not to to go through the cavities and all that stuff. Well, it's a similar with the rest of your well-being and health. The dentists were really good about doing that, and the rest of the medical profession not so good about teaching people how to maintain their well-being and health.
Right. As far as the practitioners go, do they tend to be chiropractors that buy these types of beds, or what types of people are we looking for when we look for this kind of therapy?
It's the entire fitness industry, health industry, beauty industry, um, mental health industry, and athletes are great. If you're an athlete and you want to be competitive, and you want to run further with more stamina, then you want to use red light therapy. And if you have the money, you get one of these things. And you use it in the morning and then do your routine. We worked with the Olympic Training Center for track and field in the Pacific Northwest. And I interviewed them. In fact, one of the videos I'm going to send you is with Chloe Cunliffe, who's a professional pole vaulter. And they get in the bed in the morning, or the whole team would get in the, not together at the same time. They would get in the bed early in the day, and then their activity that day would be easier, better, less chance of injuring themselves. And then they get in the bed again in the evening to recover from that. And when they wake up the next morning, normally that 8 hour, they're professional athletes, that 8 hour exercise routine that they go through would be so exhausting the next day, they'd have to drag themselves out of bed. And when we use the red light bed, that doesn't happen. The next day, they as they describe it, they wake up fresh as a daisy. So an athlete, if they're serious, it's why we have NBA teams that have our bed. As I said, we had the Olympic track and field. We have two major athletic centers in Florida that have the bed, and it's going to grow. You know, as the word gets out there, just like chiropractic grew. When I started, I was one of two or three chiropractors in my area. When I retired from active treatment, there were about 100 chiropractors in the same area. That's how chiropractic grew, and red light therapy has grown even, I think, even more. And it's been just amazing. But the danger is the crap that's out there that people are buying. I'm not objecting to local treatment. That's fine. But
Mhm.
they're buying stuff that's such junk that what happens is they try it, they use it, they don't see a difference, and they say, this whole red light therapy sucks. The truth of the matter is they didn't really try the right stuff. So you want to get to a facility that has this and try it for 6 visits and see what we're talking about.
Okay. I'm just wondering, did you have something that was in that lower price point before where it was just the application? Let's just say someone wants it just for their eyes. Is there an application for that that's short of buying the whole bed
There is no such thing as
session?
just for your eyes. As a holistic practitioner, again, I'm not suggesting everyone needs to buy this bed, but they do need to use something like this, a full body, even if it's just their eyes, because the eyes are not just the eyes. As a holistic practitioner, and you come in with an elbow problem, if you think I'm only going to be looking at your elbow, you're wrong. I'm going to make sure your entire spine is good and the rest of your body is good. And the elbow will recover much faster and stay that way much longer. So I don't have an objection to someone getting the equipment if they want to, but if you want the true full value, I liken it to an MRI. I'm not suggesting everyone buy an MRI to have in their back room so the occasionally when they need an MRI, they have it. You go to an MRI center. Well, in this case, you go to a red light center and you'll
Mhm.
get the treatment that is the highest grade and really experience what you need.
Okay.
Then after having 6 visits, then you can respond.
Yeah.
Go ahead.
Well, I'm asking the questions because I know that these are the questions that will come up with my listeners, where they're saying, well, how does this work? How can I access it easily? Um, what's the difference between this and those more targeted applications? And that I think we've kind of answered those questions at this point based on how you've described the way that this bed for infrared works. Is that fair to say?
I could manufacture anything. I
Hmm.
could manufacture all those types of pieces of equipment, and I don't. I just want the best. And so I don't want to have somebody get a lesser valued product. So we only make the Pro 450. We made the 100. It was great until we made the 200, which was great until we made the 300, then the 400, now the 450. And within the 450, this is at least the fifth rendition of it, where we've improved it, changed it, modified it, even more so.
Hmm.
And as the world of technology grows, that's what happens. It gets better. I mean, I'm sure people have iPhones, and I'll bet they have a newer iPhone because having the older one will not allow them to do what the newer phones can do. And so that's the same thing with these red light beds.
Hmm.
My suggestion is to have the best,
Yeah.
get the most effectiveness.
Okay. Yeah, so if someone's looking for the best red light therapy, then they would find someone who has your bed available in their practice, whatever
So they
that
go to
practice has.
trifectalight.com.
Mhm.
Right on the home page, it says you wanna find a bed nearest you, and then they click on it and, just fill in their, probably just their zip code, and one of our staff members will get them the closest location for them.
Okay.
And try it. It's
Yeah.
there's no, there's no downside to it. The worst that'll happen is nothing, and the upside is unbelievable. Just unbelievable.
Yeah.
Anyhow,
Sounds
it
good.
was fun. I want you to make sure that you work on that Wi-Fi over there,
I wish I could work on
and
this
have a great
Wi-Fi over
evening.
here.
I would love to ask you, how's the Chinese food? Is it good over there?
It's amazing. Yeah, and it's totally different than what you think Chinese food is. It's just like in the United
Are
States
you
when
telling me when I go to Chinatown in New York, you're telling me that that's not Chinese food?
well, it's a version of Chinese food, but China is as big as the United States, so it's like saying that the food in South Dakota is the same as the food in
Oh,
New
I understand.
Mexico.
You got Szechuan, and you got Cantonese, and you got I get that. I like Chinese food. My wife doesn't, so we don't have it as much as I would like to have it. At any rate, with that said, have a wonderful evening. I
Yeah,
hope it gave you enough information, to be helpful.
absolutely.
If people are out there, um, maybe they'll see the light and experience what I have experienced, which is great success.
Awesome.
Thank
Well,
you so much for
thank you.
entertaining me, and, we'll talk again some other time, okay?
Yeah, absolutely.